I'm really delighted to bring you the second in this webinar series, and tonight we're going to talk about diet selection and trial success in canine chronic enteropathies. And back when Aarti and I first started talking about this webinar series, we discussed that really it's something that can be feels tricky at times to select diets, for your chronic enteropathy cases to do a diet trial in, but it doesn't have to be. And I think that was kind of what we wanted to do tonight, was kind of simplify it as much as possible for you. And Aarti was going to share kind of her top tips and how she approaches these cases to make it much more accessible and so forth. So don't forget that at Purina, we're here to support you. So if you ever do have kind of difficulties and you would like to discuss any of our diets with us, we do have a technical helpline, and do reach out to us. We'd love to chat with you on that. So without further ado, I'm going to introduce Aarti, who I think probably needs no introduction really, but Aarti is an associate professor at the Royal Veterinary College in London, and she actually graduated from the RVC in 2006. She completed a rotating internship in small animal medicine and surgery at the QMH there, followed by a PhD in canine inflammatory bowel disease in 2011. And Aarti then went on to a 3-year residency at Cornell, becoming a diplomat of the American College of Veterinary Internal Medicine in 2014, and then a 2-year clinical nutrition residency at UC Davis, achieving diplomat status in 2016. And Aarti's now back at the RVC. She's now Associate Professor of Gastroenterology, Internal Medicine and Nutrition there. So no one better really to talk on this subject for us tonight. So really looking forward to hearing Aarti's talk. So over to you, Aarti. Thank you.
Thank you, Libby, for the introduction. So we're going to talk about diet selection and trial success in canine chronic enteropathies. So in terms of the overview that we're going to look at in this webinar, really we're going to look at how do we achieve dietary success in these canine chronic enteropathy cases. And this really centers on 3 main areas. So firstly, it's selecting the most appropriate diet for that patient, and we'll look at how to do that. Secondly, we'll also look at strategies to help ensure compliance from the owner and pet to ensure that your diet trial is a success. And we'll also look at other factors during the trial. So how do we transition onto the therapeutic diet? What do we do about treats? How long do we do the trial for? And when do we transition back? So we'll look at all those factors. And then finally, we'll look at how do we assess the response? And that's really important because that's then going to dictate next steps. So to start off with selecting the most appropriate diet. So this, again, is centered on 3 main areas. The first is collecting a diet history. The reason this is important is because from the diet history, what we're trying to do is we're trying to get an understanding of what strategies that owner may have already tried, or what diets they've already tried for the gastrointestinal signs. And then what we can do is we can correlate things like ingredients, dietary fiber, dietary fat levels with the corresponding gastrointestinal signs. We're really trying to recognize, are there any ingredients or nutritional strategies like low fat, fiber enriched, that either helped or hindered the gastrointestinal signs when that diet was fed. And that just helps us get a little bit more of an understanding of which strategies we should prioritize. And it also helps us identify what strategies haven't been tried. So if we get a really good diet history from an owner, and we might recognize, well, maybe low fat hasn't been tried, or a fiber enriched diet hasn't been tried, or a hydrolyzed diet hasn't been tried. So it really helps us decide where the where the next strategies may lie. And then the current case characteristics are important, particularly the patient's signalment, what clinical signs they're presenting with, what we find on our physical exam findings. Again, that may help to prioritize which dietary strategies we choose. And then finally, knowing what diets are available to you, knowing all the different categories we can use for chronic enteropathy, and just having an understanding of the pros and cons and when we might use one category over the other, again, will help you decide which diet to use. So the diet history feels like it's a big task to do. And so I do understand that we don't always have a lot of time in the consult room. So if time's a factor for you and you don't have a lot of time, what I try and collect from the diet history as a minimum is three main areas. So firstly, just general idea of what that pet likes to eat in terms of, are there certain textures of food? So this is particularly pertinent to cats. I know we're talking about dogs, but there might be certain textures that pet likes, or there might be certain flavors they like. And you can really use that to your advantage. If an owner says to you their pet really likes fish flavors, that would help determine what diet you choose possibly. And then it's important to understand from the owner if the pet will eat wet and dry, or if the pet would only eat one of these formulas, or whether the owner can only feed one or would prefer to only feed one. Because some of the therapeutic diets, they either come in just a dry or a combination of wet or dry. So it's important to know what the goal is in terms of for that individual patient and for that owner. And then in terms of correlating previous diets to gastrointestinal signs, this can sometimes take a lot of work. And if you don't have a lot of time, if you can just ask the owner one question, which is what diet have they recognized that helps the gastrointestinal signs the most? That can be a really valuable question. Sometimes owners might say the diarrhea improves with a chicken and rice diet. And if they give you that information, that might suggest that digestibility is something that might be important in helping with the gastrointestinal signs for that pet. So we might prioritize a highly digestible diet. Or they may recognize that a fiber-enriched diet worsened the gastrointestinal signs. So just asking them a couple of questions like, have you recognized or identified a diet that helps? Or have you identified a diet or an ingredient that hasn't helped or has worsened the signs? Because then we would avoid those strategies. And then finally, it's important to try and understand what therapeutic diets have already been tried for these chronic gastrointestinal cases. It's not uncommon that they've already tried a couple for the gastrointestinal signs. If they have tried a therapeutic diet previously, it's really important to ask if they were compliant during feeding of that diet. So did they feed it exclusively, and did they feed it for at least 2 weeks? Sometimes we see dogs come in with chronic gastrointestinal signs where the owner will say they've tried this diet, but what later transpires is they didn't try it exclusively or for at least 2 weeks. And why it's important to know that is because if we do need to choose that diet can help that patient go into remission if they do it exclusively or for long enough. And that's certainly been the case in our experiences. When we've gone back and tried that diet but done it exclusively and for at least 2 weeks, they have gone into remission. So sometimes it's not enough just to ask them what therapeutic diets they've used, because they might not have used it correctly, in which case that diet may still be in play and might still help with the gastrointestinal signs. The case characteristics can be important in dictating the diet we use. So with the animal, the signalment is important, particularly if they're still growing. So if they're a puppy, we want to use a diet that's formulated for growth. And the easiest way to determine if a diet's formulated for growth is to look at the pet food label. And if there are feeding guidelines for puppies, and that tells you that diet is appropriate to feed for growth. The animal's appetite, if they have a reduced appetite, then sometimes what we'll do is we'll prioritize diets that have higher calories per gram of food. So they have higher caloric density. What that means is we're then going to be feeding a lower volume of food to meet their daily caloric requirement. So that's something you might take into consideration. Similarly, if they're losing weight or they're under condition, we might want to go for a diet with higher caloric density. In terms of the gastrointestinal signs, what we need to ascertain is, does this patient have vomiting, regurgitation, nausea, the kind of upper gastrointestinal signs? If they have diarrhea, we want to classify it as small bowel, large bowel, or mixed. And then we want to determine if they're losing weight or if their weight's stable. The reason we want to do this is because depending on what gastrointestinal signs that dog presents with, again, that's going to dictate which diet we choose. So this is just a list of, a table showing you gastrointestinal clinical signs and nutritional strategies you may want to consider for each of these gastrointestinal signs if they're present. So there's no hard and fast rules. It's kind of nutritional strategies you may want to consider just to help provide some kind of guidance when you're up against these different gastrointestinal clinical signs. So with anorexia, hyporexia, we talked about increased energy density, so increased calories per gram. You might want to pick a diet with increased palatability. So again, asking the owner those kind of questions: what kind of ingredients does their pet, or what kind of flavors do they like? Sometimes canned diets may be more palatable for the dog versus a dry diet, so we can use that to our advantage as well. In terms of nausea, we sometimes might say to feed a decreased fat diet because fat in the diet, if there's moderate levels, may delay gastric emptying. So we're trying to increase gastric emptying so there's less food in the stomach, so hopefully less nausea. Highly digestible diets we might prioritize, and then really feeding smaller frequent meals is really important in cases with nausea. If the dog has weight loss or is in poor body condition, we would prioritize palatability and increased energy density. If that patient is regurgitating, we might want to decrease fat again to hasten gastric emptying, and feeding smaller frequent meals is really important because that's also going to help with gastric emptying. So the meal size will also influence gastric emptying. If the patient is vomiting, you might want to reduce fat again to hasten gastric emptying, increase digestibility. We might want to feed novel, elemental, or hydrolyzed protein diets, again, because if we're suspecting that the vomiting is due to a kind of chronic enteropathy, those category of diets have been shown to be effective. We might want to feed a diet with lower viscous fibers. So viscous fibers stay in the stomach a bit longer. So again, it's about kind of helping improve or increase gastric transit. Might want it to be electrolyte enriched, moist foods, warm foods again will empty faster, and then feeding smaller frequent meals will help with emptying as well. In terms of the diarrhea, if it's small bowel, we may prioritize increased digestibility. That's to ensure that less undigested fats or protein or carbohydrate, well, mostly more protein and fat. If undigested protein and fat reaches the large intestine, we might get osmotic or secretory diarrhea. So we're trying to feed a diet that's really digestible in the small bowel. Again, electrolyte enriched can be considered novel, elemental, or hydrolyzed protein. Again, that's to do with in case the diarrhea is due to the chronic enteropathy, and these are the kind of categories of diets that have been shown to be effective. Sometimes we might trial decreased fat if there's small bowel diarrhea, particularly if we're concerned that there's fat malabsorption happening. So that might look like secretory diarrhea or osmotic diarrhea, or there could be steatorrhea, in which case that would be an indication to reduce fat. And that's really because we want to prevent as much undigested fat going into the colon, because if undigested fat passes into the colon, that can act as like osmotically active and like osmoles and draw water in. And that's kind of the mechanism behind osmotic diarrhea. Or it can irritate the colonic mucosal lining, and that can result in secretory diarrhea. So that's kind of why we want to reduce fat. In large bowel diarrhea, fiber enriched is really important and has been shown to be helpful. So that's something we'll try. Again, electrolyte enriched, hydrolyzed, elemental, novel protein diets have all been shown to help with large bowel diarrhea. Again, decreasing fat, it kind of depends on the characteristics of that diarrhea. And then if it's mixed bowel diarrhea, we're kind of looking at a combination of these things. So increased digestibility or fiber enriched, they kind of a little bit inverse. If you're increasing the fiber in the diet, you tend to decrease digestibility. And it kind of depends what fibers you're using. So more insoluble fibers would reduce the digestibility. So typically we're trying one strategy at a time. Electrolyte-rich, hydrolyzed, elemental, or novel protein, and then whether to decrease the fat really depends. And again, it's kind of a little bit of trial and error for that individual patient to see if it helps. So I'm just quickly going to run through the different diet categories we have available to us for chronic enteropathy, and really just touch on the pros and cons of each. And that's really helpful, I think, when you're trying to decide which category to use for your individual patient. So the commercial therapeutic GI diets, the biggest advantage is that they are highly digestible. They may be less expensive than some of the other categories, particularly home cooking, maybe hydrolyzed. Because they use intact proteins and from common kind of protein sources like pork and chicken, they may have increased palatability for that patient. And some formulas have low fat, which can be advantageous if you're wanting to use that strategy for increasing gastric emptying, or if you suspect the diarrhea, fat is playing a role in that diarrhea. The disadvantages of this category, there's only been one study, and that study showed they looked at a hydrolyzed diet and a therapeutic GI diet, and they showed in dogs with chronic enteropathy, and they showed that both diets were able to attain the same rate of remission in dogs with chronic enteropathy, but more dogs came out of remission longer term with the therapeutic GI diet. So there's some concern in terms of long-term remission that they might relapse compared to managing them with a hydrolyzed diet. But if you have a patient that's not eating a hydrolyzed diet and you really are focusing on short-term remission, I think it's fine to feed these commercial therapeutic GI diets. And then when they're in remission, you can potentially move over to a hydrolyzed diet if they relapse or if you want to maintain long-term remission. Commercial therapeutic novel protein diets, the biggest advantage is the increased palatability. I think anytime you feed something novel to the patient, they usually find it more palatable, so we kind of use that to our advantage. We also have scientific studies showing that these diets work. They can induce remission at about a 50-60% rate in dogs with chronic enteropathy. The disadvantages are that you do need an adequate diet history to determine what would be novel for that patient in terms of protein source. And sometimes that can be difficult if owners don't remember what they fed, or it's a really extensive diet history and they've been exposed to so many different protein sources. Sometimes it can be hard to find something commercially available that has a kind of unique protein that that animal hasn't been exposed to. The fat content of these diets may be higher than what we would normally, that's normally found in like the hydrolyzed or the GI diets. And anecdotally, this hasn't been proven scientifically. I feel like sometimes with these diets, they may relapse after a couple of months, whereas I feel like with the hydrolyzed diets, they tend to stay in remission for longer in terms, like we sometimes see dogs with chronic enteropathy that have been managed with a hydrolyzed diet for years and they haven't relapsed, whereas with the novel protein, not all of them, I feel like it's a small proportion of them may relapse after some time. So commercial therapeutic hydrolyzed diets, the advantage is you do need a diet history. You may not need to do that really extensive antigen exposure list that we would need for novel protein diets. However, sometimes we do take into consideration the protein in the hydrolyzed diet, especially if we suspect they have like a chicken allergy. We might not want to feed a hydrolyzed chicken diet just in case they react to that. Like I said, anecdotally, I feel like there's less chance of relapse, but that hasn't been shown scientifically. That's something that would be an interesting study to do. Scientific studies and our anecdotal experiences, we expect a 2/3 response rate in dogs with chronic enteropathy using these diets. And some formulas now have controlled or low fat. So again, we can combine those strategies of low fat and hydrolyzed. Disadvantages, I don't feel like we see this that often, is potentially reduced palatability. It really just depends on that patient's disease process and what their appetite's doing. We may have limited canned formulas available, particularly for cats, and then some formulas may be more expensive compared to some of the other categories. And then commercial therapeutic fiber-enriched diets, the biggest advantage here is, like we talked about before, is in colitis cases, so large intestinal diarrhea. There's been multiple studies showing that they're effective. There are a couple of studies showing it can be effective in enterocolitis, so your mixed bowel diarrhea cases. Tends to be safe and well tolerated. Response can be relatively quick with these diets. So in one study, they showed a response within a mean of 8.5 days. And in another study, it was as quick as 1 day. They saw a response, which is great. Disadvantages is that you may require the pet may require longer term supplementation of fiber or require that fiber enriched diet long term. So it might be harder to switch back to their regular or over the counter diet. Because fiber doesn't provide any or very low number of calories, every time we use a fiber-enriched diet, potentially it has a reduced energy density. So you might have to feed a larger volume to meet a patient's caloric needs. So it's just something to be aware of if you have a patient that's not eating great or is under-conditioned, where you're trying to get that patient to gain weight. It might be harder with the volume of these diets. And then if it contains viscous fibers, it may delay gastric emptying. Just something to be aware of if you have a patient that has colitis and kind of upper GI signs like regurgitation, vomiting, or nausea, that those signs may be exacerbated. We see quite a few brachycephalic dogs with large intestinal diarrhea and kind of regurgitation, and it's really case dependent. We've had some that tolerate fiber-enriched diets and we don't see any worsening of their regurgitation. We have some where the regurgitation might increase. So it's just something to ask owners to monitor and to let you know if the upper GI signs are worsening. And then home prepared diets, the biggest advantage is the increased digestibility. We can use ingredients known to be palatable to that patient, so that can certainly help if they're hyporexic or anorexic. It allows us to precisely set macronutrient profiles, so we can set where we want the fat level, the protein level, the phosphorus level, the micronutrient, for example, if it has a comorbidity like kidney disease. So we can really custom make that diet for that individual patient. It avoids antigens from processing. There is some school of thought, we don't think this is common, but if you suspect that the patient is responding was negative, if you suspect that a patient's gastrointestinal signs are not responding to any commercial diet, then there may be some merit in trying a home prepared diet in case they're reacting to antigens that have been unmasked or developed from the processing of that food. I don't suspect that happens that frequently, to be honest. It's just a theoretical risk where home-cooked diet could help. Disadvantages are, in the UK, access to a board-certified veterinary nutritionist. If we're going to go down the route of a home-prepared diet, we say it has to be formulated by a board-certified nutritionist to make sure it's complete and balanced. It can be expensive, and so owners have to order the supplements, they have to purchase the ingredients. That can be pretty expensive compared to commercial therapeutic diets. It is labor intense. I always joke that I don't cook for myself every day, although you can batch cook and freeze. It is labor intense, and even just the equipment that's needed to cook for a 25-kilo dog, like the kind of utensils you would need, the size of bowls you would need, the freezer space you would need, the fridge space for all those kind of ingredients. I think that sometimes people don't think about that, so that's really important to have that conversation. If you're using novel proteins, again, could there be a chance of relapse like we talked about? Maybe, anecdotally, again, something that's not been really proven scientifically. Source of novel proteins. Sometimes we see pets with really extensive antigen exposure lists, and then we need something really novel to feed that patient, like alligator or something. And then it's like, well, how do we source this? Is this something we can consistently source? And then bioavailability is really important. Anytime we formulate a home-cooked diet, we're doing that using a computer software program, which is, and what we're relying on with the computer software program is that the ingredients that the owners are buying from the supermarket matches the profile we have of that ingredient in the software. So we always kind of build in a margin of error because you're never going to get it exact. And we also don't know the bioavailability of those ingredients once that dog eats the diet. So on paper, it may look good, but once the animal eats that, we don't know if they're getting all those nutrients. So with a home-prepared diet, it does require closer monitoring of that pet. We do routine blood work. We do monitor them regularly with body weight, body condition, muscle condition, just to make sure that we're feeding that those nutrients are bioavailable to that pet. So I just want to pause here because this is probably the most important slide, I would say, from this whole presentation. So if nothing else, really, if you can just remember what's on this slide, I hope that this will help you with your selection of diet and management of these cases, these chronic enteropathy cases. So some caution and some points I want to make. So firstly, it is an educated guess with no right answer when we're trying to choose a diet. There's so many factors to think about, and there is no right answer. And if you present the same gastrointestinal case to 5 different nutritionists, wouldn't be surprised if they all picked a different diet that they would use. So it's not so much there's always going to be a right answer. It is a little bit of trial and error involved in terms of picking a diet and seeing what it does and then deciding, do we switch or do we stick with that diet? So it's really important to warn the owner that you may get it wrong. And I certainly say this to my owners when I'm selecting a diet. And I say, for example, I want to choose fiber enriched because it's never been tried before. I think it might help because your pet has large bowel diarrhea, but I don't know if it's going to make the diarrhea worse. I don't know if it's going to help, but it will provide us with a data point at least. And we'll know relatively quickly whether that patient's going to respond or not. And it can help us because it will help determine whether that's a strategy we've used and it's not helped. So we're going to move on to something else, maybe a highly digestible diet. So I think it's okay if you pick a diet and you're worried it may not be the right one. I think just as long as it's in one of those categories, I think it's fine to try, just as long as you've warned the owner that this may worsen the signs, this may not help. Like I said, it will give us a data point, which is important to then work from. The really important thing is to convey to owners, and there has been a study that has shown this, and certainly our experience is that it can take more than one diet before we see a response. Sometimes it can take up to 3. I've spoken to other people, and my experience sometimes has been, for some cases, it might take more than 3 different diets before they go into remission. So don't give up after the first one. If they're not responding, try a different category. Hopefully they'll respond with the second or the third. The good thing is if we're going to see a response, we'll likely see it within 2 weeks. So we usually switch out after 2 weeks. So we're not keeping the dog on these diets for 6 to 8 weeks. We'll make a decision at that 2-week mark whether to switch strategies. Accurate monitoring is really important when you're trying a diet. So it's really important to get an idea of, did the signs worsen? Did they improve but didn't improve that much? We need to get an idea, and we'll talk about this later, but accurate monitoring is really important because it will help dictate what strategy we might try next or whether we continue with that diet. So accurate monitoring is important because it allows us to be methodical about the next strategy or diet. But what is really important is this whole process of trying 3 different diets, recording everything, being methodical about the next strategy. We may not need that for every case. So there was a study which was published a couple of years ago by Kenny Simpson's group from Cornell, where they looked at a randomized controlled trial of hydrolyzed fish diets in dogs with chronic enteropathy. So in this study, they had 2 different diets. One was a hydrolyzed fish diet, and the second diet was a limited ingredient diet containing mixture of non-hydrolyzed proteins. And what they showed is that changing diet, independent of antigen restriction or supplemental ingredients, induced long-term remission in dogs with non-PLE chronic enteropathy. So this kind of supports the theory that just changing the diet, in some cases, in a proportion of cases, just changing the diet may be enough. It doesn't really matter which diet you choose, just changing that, whether it's hydrolyzed or novel protein or a gastrointestinal diet, may help that animal go into remission. So I certainly think that there is a proportion of cases that are likely to go into remission with that first diet. And then there's a proportion where they require a little bit more TLC in terms of they haven't responded, so tender loving care, they haven't responded to that first diet. They require a little bit more troubleshooting to try and determine which second diet or third diet we're going to use to get them into remission. And then obviously we have that other category which won't respond to diet and need immunosuppressive medication. So In terms of choosing that first diet, this study suggests we might not have to worry so much about which one we choose, just changing the diet to one of those categories we talked about, and monitoring is really important. And if they don't go into remission, then really trying to determine what other strategy we should use. So the second part of this talk I want to talk about is ensuring compliance from both owner and pet. This is really important because we need the owner to be on board. We need them to be willing to feed that diet in order for our diet trial to be a success. And we also need the pet to eat the diet in order to get the benefits from that diet and for their gastrointestinal signs to go into remission. So this is just an overview of how do we ensure owner compliance with these diets. So this centers around three main things. So firstly, owner education, and we kind of touched on this a little bit when we talked about in the previous couple of slides. So it's really important that when you speak to owners, you talk to them about importance of diet in chronic enteropathy and how important it is we manage these patients with diet, and the majority do go into remission. It's just finding the right diet, and that is trial and error. So it might require 2 or 3 different diets before we hit the right diet that helps that patient go into remission. The other thing that I think it's important to relay is the repercussions of the owner not taking our advice. So if they don't feed the diet, if they're not willing to do a diet trial, what may happen is that patient may end up on immunosuppressive medications. And what we know from a couple of studies is that patients that are treated with diet, so chronic enteropathy cases that are managed with diet, they have a greater reduction in their clinical disease activity than those patients that are treated with glucocorticoids. So it's in the pet's best interest, it's in the owner's best interest, it's in everyone's best interest. We really try diet because that's the best chance we have of reducing the clinical disease activity index. And what the studies also show is that dogs that are treated with diet, with chronic enteropathy, that are treated with diet alone, they have a better long-term better prognosis compared to those dogs that are treated with glucocorticoids for their chronic enteropathy. So in order to reduce the clinical disease activity as much as possible, in order to improve prognosis, we really need to try diet, and we really need to take time and find the right diet. So that's the kind of message that I'm really trying to convey to the owners. Now, there's going to be a proportion of dogs that aren't going to respond to diet with chronic enteropathy, and we do need to use immunosuppressive or medications or glucocorticoids. So there is going to be that proportion, but the majority will respond to diet. So we say 2/3 will respond to diet. So it's worth doing that diet trial. It's worth doing it right, doing it correctly, and trying another diet if the first one doesn't work, because we really want to find that right diet for that patient. It's important to relay to owners that the recommendations we're giving is really tailored to their individual pet, that we've taken the gastrointestinal signs, the diet history, the signalment, we've taken everything into consideration to come up with that diet recommendation. So just so that owners feel that we're not just giving them a generic kind of recommendation, that we really thought about this for their individual pet. And then it's important to give clear recommendations when we're recommending a diet. We need to give the exact diet name. So sometimes people will say just to feed a hydrolyzed diet. They won't say which exact diet they want to feed. And the reason we want to give the exact diet name and not just the category of diet we want the owner to feed is sometimes we've had cases where the dog will respond to one formula in that category, but not to another. And so sometimes we'll try 2 different diets in the same category, like 2 different hydrolyzed diets in that same category of hydrolyzed diets, and they've gone into remission with one, but they didn't go into remission with the other. So it's important to name the exact diet so that in the scenario where they failed that one hydrolyzed diet and we want to try a second, the owner's not going to get frustrated. I think if you tell owners, or let's feed a hydrolyzed diet, they might think all hydrolyzed diets are the same, and so they might be unwilling to try a second one if they fail the first one. And we know that dogs can go into remission with the second one when they fail the first one. So it's just important to be really specific. It's also important to inform owners whether you want to feed the dry or the tinned. Give them as much information because that will help with compliance. How much you want them to feed. If you don't have time to work this out, you can just ask them as a minimum. You can just let them know to feed according to the pet food label guidelines, just the packaging guidelines, and how frequently you want them to feed. So think of it like as you would with the medication, in terms of if you're prescribing a medication like an antibiotic, you would say exactly which antibiotic, you would say how much, you would say how frequently, how long the course is. So that's kind of how we need to treat diet. And so how long you want the owner to feed, what they should do about treats, where they can get the diet from, that's so important. We've had a couple of cases where they've run out of the diet and the owner didn't know that this is a diet they have to get from the vet. So they've gone to the supermarket, they've seen sensitive stomach or hyperallergenic on the bag, assumed it was the same and fed that diet. So that's really important that they know that this where to get that diet if they run out. So sometimes this can be a lot of information to relay to the owner, particularly at at consult. Times that we have, sometimes we don't have a lot of time in our consults to be able to relay all this information. So you can utilize a nurse in your practice to relay this information, or sometimes I have seen really nice handouts for these kind of dietary management of chronic enteropathy, which you can ask the owner to read and then sign. And then just finally making sure that that relationship with the owner is the communications we're having with owners are relationship centered. So using non-verbal cues, checking in with their thoughts, I think is really important. So sometimes we'll have owners come into us that they'll say they don't want to do diet, and we'll ask them why, and they'll say things like, I don't want my pet to stay on that diet for the rest of its life. And that's a really important, it was really important to ascertain that's what the owner was worried about, because sometimes they don't need to stay on these diets. Sometimes we can transition away after they've gone into remission, and we say the majority won't relapse. So it's certainly something we can try. So that's important to really address any worries that they have. Signposting is important so that they know where to go. Follow-up is important. Let them know when we're going to be when the follow-up will be. And some nutritionists will forward book their appointments, so they'll book a recheck in 2 weeks or 6 weeks to make sure that owner will be compliant with the diet, because they know that recheck is coming up. So ensuring pet compliance, this is a little bit difficult sometimes. So sometimes we'll have owners tell us that the pet won't transition to the diet, or they don't like the diet. And so there's 3 main areas we can focus on to try and get that pet eating. Firstly, it's just really important to recognize there's no stress in the environment, and we will look at this because this is a really important factor that we're beginning to realize, is that particularly with some owners, if they're portraying stress, that can really impact that patient's during meal times, and that's important to recognize. Sometimes we'll let owners know that they can try feeding from a dinner plate. Sometimes that can really help. Dogs feel like they're getting something really special on a dinner plate. Social competition, so if the owner has other pets, or there's pets in the family or friends that they can feed in the present, sometimes that can help. Timing feeds with when the family sits down to eat can also help. Warming the food, adding water, considering the flavor and textures of food. This is where your diet history can help. Prioritize certain formulas, or using novel proteins may help. Sometimes we can use appetite stimulants, and we'll do that when we're trying to transition them if we're worried they won't transition. Palatine enhancers are things like, what works for us is Fortiflora. We really like the Fortiflora probiotic. Because it has an animal digest, we kind of make a warm water gravy and then we put it over the kibble, and that seems to work. And just making sure that the reason that patient isn't transitioning or not eating the diet is make sure it's not due to nausea, and that we're optimizing any anti-nausea that might be present with anti-nausea medications, and then addressing if we're concerned about pain, just making sure we're addressing analgesia effectively if we think that could be contributing. So the transition period, once you've picked a therapeutic diet, we usually say to transition to that new diet over 7 to 10 days. So the way that looks is over that 10-day period, what we would do is we would slowly reduce the amount of the old food and increase the amount of the new food we're transitioning onto over that 7 to 10 day period. So during that time, they're eating that new diet 100%. So there's a couple of scenarios that have happened to me during this transition period. So sometimes I'll get owners frantically calling me after 2 to 3 days of the transition period, telling me that the GI signs are worsening and they're really upset or they're really concerned. And usually I'll say to those owners that to continue with that transition and just to monitor that dog. And if the signs continue to worsen or they don't improve over the next 24, 48 hours, to give me a call back. And in the vast majority of cases, I don't hear back from those owners until their 6-week recheck, where they've transitioned onto the diet and they've been feeding it for 6 weeks and everything's gone well. However, if the signs do continue to worsen or they don't improve after that 24 to 48 hours, then we might have to transition off that diet. However, I feel like in a lot of the cases, they seem to do fine once they get over that hump. And then we have some scenarios during the transition period. Another scenario is where the owner said during the transition period the gastrointestinal signs improved and everything was going really well, and then they started to worsen as they introduced more of that new food. If that happens, sometimes what I'll say to owners is just to stick to the two diets, and this is making sure that the old diet was complete and balanced, appropriate for that pet's life stage. If they're both complete and balanced and appropriate for life stage, then they can feed both diets at the proportion that helped improve the gastrointestinal signs the most, if that works for the owner and the pet. And that's not a common scenario. That's happened a few times that I can remember. In terms of the length of the trial, the initial response where we're deciding whether we want to switch out or whether we want to continue with that diet typically happens at the 2-week marks, and that's 2 weeks of exclusive feeding. So that doesn't take that transition period into account. So once they're on that new diet for 2 weeks exclusively, we'll see how they're doing. With fiber enriched, it can be a really quick response. So sometimes it can be a day or a week. And then if they're doing well at that 2-week stage, we'll say to go out to 6 weeks. If they have concurrent dermatological disease, we'll typically say to go out to 12 weeks. If we see no response at that 2-week mark or worsening of signs, then we might try a different diet or we might try medications depending on that individual case. If this is a case where the albumin is decreasing or they're decreasing their body weight is decreasing or suddenly their appetite is decreasing, then we might want to do further diagnostics versus just keep going with another diet just to make sure there's nothing else going on. And then in terms of treats, what we do about treats is a really interesting question. Because when I think about treats, I think about the treats that they were feeding when they presented for the gastrointestinal signs. This is so interesting because so we collect diet history. We give owners of dogs with chronic enteropathy, we give them a diet history form to fill out. And then I was looking at this one case, this dog that came in with chronic diarrhea, and I was looking at this dog's diet history form, and so much of what the owner was feeding, there was probably about 6 or 7 different treats daily on that form. And so we asked the owner just to stop all the different treats they were feeding. Don't change the diet, just take the treats away. And that was enough to resolve that dog's clinical signs. So the owner, after stopping the treats, she sent us this email. She said, it's been a few weeks now and I've eliminated all chews and treats. So she's only been eating the diet, which we didn't change. Thankfully, she's completely back to normal now with a soft stomach, no gas, normal eating habits and regular energy level. If we hadn't have collected that diet history or if we hadn't asked about treats, we wouldn't have had that suspicion, because when you ask owners what they're feeding, they'll tell you the name of the commercial diet. They may not tell you about the treats unless you specifically ask them. So because we had this diet history form, and because we could see all these different treats, we asked them to stop the treats first. And so this dog didn't need to change its main diet. It was enough just to stop the treats. And then I think about treats moving forward, because when we're changing the diet and we're asking owners to feed that diet exclusively, sometimes they need a treat allowance, and that sometimes can become difficult, especially if we want to feed that diet exclusively. So how do I deal with this scenario of treats moving forward with the new diet? The ideal scenario is to exclusively feed that diet, and once they're in remission, then we can introduce one treat at a time and make sure they don't come out of remission. That's the ideal scenario, but we understand that the ideal scenario isn't always possible. So if they need treats earlier, during that process before they go into remission, we can either use the dry food they're feeding, or if there's a canned formula of that dry food, what we can say is, we typically say no more than 10% of the daily calories they can take as the canned food to form biscuits in the oven. So they can put it in the oven, that canned food, no more than 10% of their daily caloric allowance, and they can make it into biscuits and feed that as treats. Sometimes that's not enough, and they need something else. So what we say in this scenario is we can compromise the exclusive feeding, because that is more desirable than abandoning the trial. So what we say in this scenario is, we say they can feed another single ingredient, or a food stuff like cottage cheese or chicken breast, but just as long as it forms no more than 10% of the daily calories, to avoid unbalancing the main diet. So that's why we have that 10% rule. We have had dogs go into remission even when the owner's been feeding something else with that diet. And so if they go into remission, that's great. We don't want to abandon the trial. There are some cases where they do need to be fed it exclusively to go into remission. We believe dogs with chronic enteropathy have kind of different tolerances in terms of, or different thresholds in terms of how much of that therapeutic diet they need in order to go into remission. And actually, there was a study that was done that hasn't, I don't think it's been published, but what they showed is that a lot of these cases that are having a therapeutic diet, owners are still giving other things and they can still go into remission. So if you have to compromise, I think it's okay to compromise, because that patient may still go into remission. So it's still worth trying. And if they don't, then we can troubleshoot from there. But if they do, great. So it's worth trying versus abandoning the trial, because they might go into remission with that. And then feeding frequency, typically we'll say to feed multiple small meals. That's to prevent overloading of the gastrointestinal tract. It can improve gastric transit, like we talked about, because a smaller volume will empty faster. It can improve digestion and absorption of nutrients. There are some cases, however, where we do say to feed less frequently, and that's really taken on an individual basis. Sometimes you'll have cases where the owner will say they've recognized a pattern, like because every time you feed that pet, their gastrointestinal tract's motility will increase. So there might be some scenarios where the owner says every time that pet eats, it goes out to the bathroom, it will have diarrhea like 45 minutes, an hour after. So if we feel like gut hypermotility is an issue, then we might say to feed less frequently to try and prevent that. So we talked about stress and how that can really impact dogs eating and transitioning to the diet. And so recognizing if stress is present and reducing that can really help. So how do we do this? So this is where the diet history can help. On that diet history form, we ask who feeds the dog, how the dog is fed. We ask, how does the dog eat with other family members, friends, or dog sitter, and if there's any stressful triggers during meal times. These are really important questions to ask owners, because it really helps increase their awareness. We've had a couple of cases where we ask owners how their dogs are fed, and they say they're fed with me while I'm watching over them while they're eating from the bowl. And that really kind of really stresses to us how stressful it must be for that dog. And so in those scenarios, we've asked owners to purchase an automated feeder and to take themselves out of that process to try and reduce stress. And sometimes that can help. In other scenarios, we've recognized and we've helped owners recognize that their dog seems to eat better with another family member. And so we've had one case where we were able to successfully transition a dog over to the diet with a family member feeding the dog, not the owner. So sometimes asking those kind of questions are important. And it also helps owners realize that, and they don't mean to do this, they just sometimes, they really want their pet to eat. I mean, it is stressful when your pet's not eating, and so they really want them to eat. And so they do hover over the dog, and every time the dog goes to the food bowl, they do, get a bit worried if they're eating. And I think the dog can sense that. So trying to remove that is really important. And I think once owners realize they're doing that, then they understand that that might be playing a role. So interventions are going to be individual based. Some may improve with just these kind of strategies to try and remove that stress. And whether that stress is contributing to the gastrointestinal signs is something else to consider as well. So another really important factor in this, which again is not common but is something to be aware of, is how the owner is storing the food. So this was a case that we recently saw at the Queen Mother Hospital for Animals. This is a 6-year-old male neutered border terrier that presented with intermittent vomiting and mixed bowel diarrhea. And it had a routine fecal analysis performed. And the lab told us that they detected mites and eggs in the feces on 2 occasions, and they identified them to be non-parasitic Tyrophagus putrescentia forage mites. So they said to us, this isn't anything to worry about. These are non-parasitic, they're just forage mites, nothing to worry about. But the clinician who was supervising this case felt it was interesting because he'd never seen this finding before. So he emailed our parasitologist at the RVC, Professor Mark Fox. And what Mark said is that he's encountered a number of cases in dogs similar to this one, which were associated with stored feedstuffs. And he's actually published this as a short communication in the veterinary record. What's interesting is that these mites sometimes can be confused with strongyle eggs. They're not parasitic because if they were parasitic, the number of mites ingested would tend to be much lower, and therefore the number seen in the fecal samples correspondingly lower. So he asked if there was anything in the case history that would support the hypothesis of free-living mites, such as dried biscuits or other dog feed kept in large bins that might not be cleaned out between batches. And in this case, are there any dogs in the household? Are they given the same feed? Are they showing similar clinical signs? So when we went back and asked the owner did say they're storing the food in large bins, and we asked them to store the food in the pet food packaging that it comes in, and that's really important. We always advise that, to store the food in that packaging. So that's important. But what's really interesting is when we spoke to Mark, he said that he's seen these cases, and when they switch from storing the food in large bins to in the packs, the diarrhea resolves, the gastrointestinal signs resolves. So the mechanism of these free-living mites is, we don't know why they're causing diarrhea. Some theories is that either the fimbri on the mites are irritating the gastrointestinal lining, or they're causing some kind of electrolyte shift. But it's these mites that were leading to the gastrointestinal signs. So this dog didn't necessarily need its diet changed. It was just the way the food was being stored that needed to change so that it wasn't ingesting these free-living mites coming from the food. So this is so now our diet history forms include how is the food being stored. And it's really important to ask that question to make sure that that pet's diarrhea isn't from one of these kind of, isn't from this mechanism. And so this is not common, but I think it's something that might have been missed in this case if this clinician hadn't emailed Mark, because the lab weren't worried about it. They said these aren't parasitic, you don't need to worry. But it shouldn't have been in the feces. So we're glad we asked our parasitologist, because otherwise this patient would have had its diet changed. The owners may have still kept that diet in these large bins. The signs wouldn't have been improving with different diets. It might have ended up on glucocorticoids, who knows? So asking about food storage is really important. So finally, in the next 5-10 minutes, we're just going to look at assessing response and next steps. So assessing response and next step is really, it's two factors that are important here. The first is pet-related factors. So we want to look at if body weight, body condition score is improving or maintaining, if they're ideal conditioned. Are the gastrointestinal signs going into remission? There are disease activity indices you can use, and we'll look at the next slide. And if you see at least a 75% reduction in these activity scores, we would say that's full remission. If you see a 25 to 75% reduction, we would say that's partial remission. And if there's less than 25% reduction, there's no remission. So typically, we define remission as full, partial, or no, depending on how much activity index reduction there is. And then owner-related factors are really important. Sometimes I'll ask owners what percentage improvement do they think there's been, and that never really ever, some of the time, but sometimes it doesn't marry up with the remission that I've got when I do the activity scores, which is really interesting. So owners have sometimes unrealistic expectations. So it's important to ask them what their expectations are, make sure they're reasonable. And also quality of life and their perception of quality of life is important. So this is just an example of the disease activity scores we use. So there's two, there's the CIBD-AI on the left, and then there's the CCECAI on the right. And we look at different gastrointestinal signs, and we score them 0 to 3. So attitude, activity, appetite, vomiting, stool consistency, stool frequency, weight loss. And then the CCEAI also looks at albumin, serum albumin concentrations, ascites, peripheral edema, and pruritus. And then we give a global score, and we want to see at least a 75% reduction when they come for their recheck. So this is a dog where we saw full remission. So this dog on the left, he presented, has a protein-losing enteropathy. You can see really reduced body condition and muscle condition score. This dog had diarrhea as well. And then we managed it just with diet, and it went into full remission. So there was more than a 75% decrease in its clinical disease activity. You can see it's gained weight, its coat looks better, its muscle condition looks better. So this dog has gone into full remission with just dietary management alone. So typically, once they've gone into remission at the 6-week mark, we give the owners the option of whether they want to continue on the diet or transition to an over-the-counter diet to see if they stay in remission. I would say the majority of owners want to stay on the diet, on the therapeutic diet, which is fair enough. If the patient has protein-losing enteropathy at that 6 to 8 week mark, if they go into remission with diet alone, we don't switch out diet. We keep them on the therapeutic diet for as lifelong. And the reason is we did a study and we compared 3 groups of dogs with protein-losing enteropathy. So those that were in sustained remission for at least 2 years, those that went into remission and then relapsed, and the third category, they never went into remission. And the difference between the ones that went into remission and then relapsed was because owners were deviating from the diet. So with protein-losing enteropathy cases, we're a little bit more inclined to keep them on the diet, the therapeutic diet, lifelong or as long as possible. Whereas if they don't have protein-losing enteropathy, we might, if the owner wants to feed an over-the-counter diet, we might try that after the 6-week period. If they have this partial remission, which is a 25 to 75% reduction, sometimes what we can do is we might not change the diet, we might add either a probiotic or a fiber supplement just to push them up above that 75%. So on the left, this is a photo from a dog with granulomatous colitis. It was a French bulldog. And it went into this 25 to 75% remission with enrofloxacin, but it was still having kind of colitis episodes. And then it had been on a hydrolyzed diet as well, and it was still having these colitis episodes. So we added a fiber supplement, and that really helped improve its stool quality on what you can see on the right. And so that really pushed it up to above the 75. So we didn't have to switch out the hydrolyzed diet. We just added a fiber supplement. So sometimes you can do that with the partial remission cases. And then finally, with your no remission, which is less than 25% reduction, this is when we're going to be trying another diet. So typically we'll try 3 to 4. It will be dependent on a case-by-case basis. This isn't like a blanket, everything needs to get 3 to 4 diets. It has to be on a case-by-case basis. We have to make sure serum albumin's not decreasing, body weight's not decreasing, their appetite isn't decreasing. If they're otherwise well, if their weight's stable, eating well, those sorts of things, then we'll try another diet. And typically I'll do 2 hydrolyzed, 1 limited ingredient or fiber enriched, different combinations. Again, it's going to depend on the case. So assessing response and next steps, this is where they might require a little bit of TLC, like we talked about, a little bit more fine tuning than ones that will go into remission first time. So I like asking owners to share photos, and that really helps me decide how things are going, what kind of improvement are we getting. So the first photo on the left, this is actually from a cat. So I apologize. I know we're talking about dogs, but it's just kind of highlighting the principle. So this was a hydrolyzed diet, moderate fiber content for cat. And you can see some form to the stool, but there's still some blood there. So then we decided to drop the total dietary fiber lower and do just hydrolyze, more digestibility. You can see a lot of mucus there. And so then we decided to do fiber enriched, and the feces massively improved, and this cat went into remission. So this is an example of requiring 3 different diets. Sometimes having tables like these can help, just really help you decide to log and monitor the different strategies and what's improving, what's worsening. And these columns, like frequency of defecation, pain, straining, crying on defecation, what you put in those columns is going to vary for your case depending on what clinical signs they present with. In terms of dietary fiber, the question I get asked a lot is, how do you know what's low, moderate, and high? There is no consensus really among veterinary nutritionists, but this is a table that was taken out from a review article, and I think the majority would probably agree with these categories. And so just highlighting that one total dietary fiber that we used is kind of in the moderate range. And so when we saw all that mucus, we decided to so when there was still blood, we decided to drop it, and then so we actually used moderate. And then when we saw there was blood, we decided to drop it, and then it didn't improve, and then we went to fiber enriched. So finally, I just wanted to, again, just a word of caution, just to be aware, not to change diets just for the sake of changing diets. Don't just change diets to get to that magic number or 3 or 4. There needs to be some rationale, reasoning behind it. You want to see some justification for changing strategies, some kind of improvement. And really the reason why is, again, this is a study that was done in cats. So this study in cats showed cats with colonic fibrosis are less likely to go into remission, more likely to die from their gastrointestinal disease. So what we don't want to happen is, as we're just changing diets just for the sake of changing diets, if that inflammation is ongoing in the background, we don't want fibrosis to develop, because once that develops, maybe the prognosis might be, it might worsen the prognosis. So we really want to put some thought behind changing the diet. And so it really should be done on a case-by-case basis, taking into account what the clinical signs are doing at each juncture with the diet. Those are some references there, and thank you so much for listening. I hope this has been helpful.
Thank you so much, Aarti. That was a really brilliant presentation and very, very practical as well. Lots of great tips in there. Um, Thank you. Everybody's submitting their questions as well, and we'll go to those in a wee minute. I just wanted to bring you through just some news on our EN portfolio, which is our GI intestinal range, just before we move to the Q&A session. So we have some new additions to our range, which you can see here. So you can see we have the regular EN, which comes in a dry formula, but also a canned formula, and also our feline, which comes in the dry, the canned, and then the pouches as well. Let me just see if I can move on the slide. Yes, I can. So just some updates is that now the EN cans, there's also a little mini can available, a 195 gram can. So that can be really good for those little dogs, or where you don't want to open maybe one of the bigger cans, or you can use it for example, on a topper or something like that for a bigger dog on top of dry food. It's complete and balanced, suitable for puppies like the EN can. So you can give that to puppies up to 5 days, and the dry EN you can feed for puppies indefinitely as well. Then we also have a new product called EN STOX gastrointestinal small and mini, and this is a little bit of detail on it. So it's big news for small dogs. So this is a formula that's been specially adapted for those little smaller dogs and their faster metabolism. Very easy to digest. It has similar ingredients to the regular EN, so with prebiotic inulin fiber to help kind of improve that microbiome balance. And also it's limited in fat like the regular EM. So, and that with some MCTs in there to help you bring down the long chain fatty acid content. And that will help with easy gut fat absorption. It's a little kibble. It probably looks massive on your screen right now, but I can assure you it is a little kibble for those little dogs. And you'll also see here our STOX formula on it. So this is our struvite and oxalate claim that you'll see on there. So the kibble has been formulated to help reduce the mineral concentration of those particular minerals, struvite and oxalate, in the urinary environment as well. You'll often see that STOX claim on our cat products, but in this case, it's a little mini dog has it as well. Just moving on to fat, if you hopefully attended our last webinar in this series, it was all about fat sensitive diseases, and you can still access that webinar. I think Paul mentioned it there at the beginning, maybe might mention it at the end as well. But so we looked at diseases that will benefit from having even lower levels of fat. And we know that a limited fat diet can help to minimize the risk of fat malassimilation. If fat does kind of get through down into the colon and so forth, it can cause different alterations down there. So altering the microbiome composition. It can promote the passage of water into the colon, and you can get loose stools as a result of it. And it can result even in pro-inflammatory compounds as well. So by decreasing the fat even further, some conditions might benefit. And for example, pancreatitis, protein losing enteropathy, maybe for example with lymphangiectasia, and hyperlipidemia as well, of course. And so I'm pleased to announce that we've added another diet to the EN portfolio, which is our new low fat diet. So with an even lower level of fat than the regular EN. Very highly digestible as before, and high in medium chain triglycerides as well, and with the inulin. So a new product that is available now in your wholesalers. If you are interested, just get in touch with us. It has 8.1% fat on a dry matter basis, and I can send you more details if anybody reaches out this way. So thank you for your attention to that, and I'm going to move now to our Q&A. So Aarti, let's go. Let me have a little look and see what's come in. Certainly there was quite a few came in over the course of the evening. So, and I'm trying to see some of them you have answered, I think, in the course of the presentation. But one question around, when would you just give up on changing diets
Yeah.
altogether? You would go to an immunomodulator or something like that?
Yeah, it's a really good question. Typically, in our experience, I would try at least a couple of hydrolyzed diets, and then depending on if the patient has colitis or small bowel diarrhea, I might try a novel protein or a fiber enriched. So I would give it three, and if I felt like we weren't getting anywhere, and there was no, like sometimes you will do three, and what on with one of them you'll notice like 40-50% reduction, and you're like, oh, this looks promising. So that kind of encourages you to really try a little bit further. So it really depends. Typically I would say three, but it's hard to give a number because it's so case dependent, but it also depends how they're responding and whether you think it's going to be food responsive. If you see nothing happening after three diets, there's been no reduction, then I think you immunosuppressives.
Okay, thank you. And then in terms of transitioning, when you do try those three diets, whatever, Artie, you talked about a 7-day transitioning right at the beginning. Should you do that same period of transition when you switch diets in between?
Yeah, usually I do. If it's a protein-losing enteropathy case, sometimes I don't transition them because I want them to start the low-fat diet quickly. Um, so I don't always. But yeah, I think the recommendation is to do a transition every time if you can.
Thank you. Question here about supplements. And what's your experience about supplements such as glutamine and beta glucans? Do you find that they help with chronic enteropathy?
I haven't really used them, so glutamine I haven't used. I know there's a lot of theoretical evidence using glutamine, but I feel like it would be nice to see that supplement in a controlled clinical trial in dogs with chronic enteropathy and what benefits we're getting, like just quantify that benefits before I would use it, I would say. Yeah, the
Thank you.
diets are
And just
typically complete and balanced, so they should have enough of those
they should
levels. Yeah.
yeah, yeah. And then just staying with supplements, Artie, psyllium husk. What are your thoughts on that? Is that something that you
Yeah,
use?
yeah, I absolutely do use psyllium husk. I use it in those cases where you get the kind of the partial response, the kind of the 25 to 75% where you're seeing some response, but you might want to just see if you can add a fiber supplement to see if you can get it beyond that percentage. So I do use psyllium, yeah, for kind of the diarrhea cases.
Yeah, and just and watching out because some of the formulas I think can contain xylitol, I think,
Yeah.
potentially. So it's just making sure that it's kind of a pure psyllium husk, isn't it?
Yeah, pure psyllium husk. And then there is some concern depending on the manufacturer who formulates whether there could be other contaminants. So you do want to make sure that you're using a kind of reputable manufacturer. So sometimes we'll use now kind of product.
Hmm. Hmm. Okay, thank you. This one I think you've answered, which is if the owner says they don't want to stay on the new diet forever, how long should they stay on it before they can try going back to another diet or a previous diet? And I think you said about a minimum of 6 weeks.
Yeah,
Yeah,
minimum of 6 weeks.
right.
Yeah.
Yeah. Okay, lovely. Um, question here about would changing a diet every so often in a healthy pet could that stop or prevent enteropathy? Is
I've
that
had this question before. I've been asked this question before. I don't know is the answer. Um, I think we need more studies looking at factors that influence what factors influence development of chronic enteropathy. But I think that could be a relatively easy study to do. You could look at dogs with chronic enteropathy, control dogs, see what different diets they were exposed to, the number, and see if it's different. But I don't know if we have the evidence to say.
Mhm. It's an interesting question, isn't
Mm,
it? Artie, what are your thoughts about the link between diet and anal gland issues?
mm,
It's a little bit, we're
yeah.
moving a little bit away from chronic enteropathy, but what's your
Yeah,
thought?
so do you mean in terms of if the diet isn't so if it's not bulking up the stool, the anal glands aren't emptying. So we're looking at what it
Yeah.
the impact or how to treat it?
I don't have the context, so
Okay.
it's just a standalone question. But
So
can it be of benefit to consider
yeah,
diets
so
there?
we do say to add more fiber to the diet to bulk up the feces to help with emptying of the anal glands. Yeah.
Mhm, mhm. Question here, Artie, about um, what do you do with a patient that needs a high energy food to recover from weight, like a weight
Mm.
loss, but it can't digest fat. Maybe it's got a liver problem or something like that, and it struggles with fat. What do you do in that
Yeah.
case?
That's a really good question. We've had like the slide I showed you with that protein losing enteropathy dog. So for a lot of the protein losing enteropathy dogs we see, they come in very low body condition, very low muscle condition, and even when we use low fat diets, we can still, because those diets are helping with the inflammation in the gastrointestinal tract, we can get them to gain weight and we can get them to recover. So, really, you don't always need high fat. It kind of depends on the underlying mechanism of what's driving that diarrhea and weight loss, and whether we can use nutritional strategies to help with that. Because if we can help prevent that diarrhea or address the diarrhea and help with reducing the inflammation in the gut, then theoretically that will help with like nutrient absorption and allowing them to gain weight.
Thanks, Artie. Thank you. Um, Another question about, based on the literature and your experience, is it possible that a patient who was well controlled with diet might become a patient later in life who might need glucocorticoids or
Yeah,
something?
we've seen that with a couple of, especially the protein using enteropathy ones again, that they go into remission with the low fat diet and then they come back and they're out of remission. Then we have to put them on glucocorticoids. So it can happen for sure. Yeah.
And we
So
don't
it's
know kind
something.
of what's going on in those cases, really. It's a bit of a
No.
mystery.
Yeah, I think it's just they have relapses, and then their relapses this time are just more severe, that we can't get them into remission with diet, and we need to get them into remission quickly, so that we resort to glucocorticoids.
Yeah, yeah. And Artie, you talk quite a lot. It's really helpful in the presentation, all about how to communicate best with owners, how to talk them through the trial and so forth, and how to talk through a lot of those feeding management strategies as well. So I've got a question about kind of how you would talk to the client. For example, so the GI signs have resolved with a hydrolyzed diet, but when the original diet is reintroduced, the dog or cat is okay, which we know sometimes can
Mhm.
happen. How do you explain that to the owner?
So how do I explain once they go into remission that we want to if they want to transition to an over-the-counter diet, we can.
Or when they do transition back to
Mhm.
the over-the-counter diet and the animal is okay, and
Yes,
it's like, has their disease gone away, or how do
I
you
see.
explain that to the owner?
So there's been two studies that have been done, one in dogs and one in cats, and what they show is that the majority actually can go back to the original over-the-counter diet and stay in remission. And I think it's like 75% of them. So in terms of, I would still say to monitor those patients, because it is a relapsing remitting disease. Chronic enteropathy, they can come out of remission. Um, so monitor them, but in terms of why aren't they relapsing when you go back to the original diet, it's the same in kind of people with inflammatory bowel disease. When you're going through a flare, you can't tolerate certain foods, and then once you're in remission, you can, is how I can describe it.
And probably people
Yeah.
can relate to that, really, can't
Mm.
they? Because quite
Yeah.
often they might have had symptoms, like that
Yeah.
themselves as well. Yeah,
Yeah.
yeah. Um, So we've probably just got time to cover one or two more questions, Artie, if that's okay.
Mm.
Um, you'd mentioned about using enrofloxacin in the case there. And so this
Mm.
question really about kind of antibiotics
Mm.
and, you know, should we avoid them altogether, or are there some cases where they might be appropriate?
Mm. So that dog had granulomatous colitis. That's probably the one of the major, or probably the only chronic gastrointestinal condition where we would use enrofloxacin, because it's caused by an adherent invasive E. coli, and that is the treatment that we would use for granulomatous colitis. The only other scenario you would use them is if you suspected that the patient had some kind of bacterial translocation from a really inflamed gut and had signs that you would worry about sepsis, or there's been bacterial translocation. That's when we would use it. Those are kind of the two scenarios. But otherwise, this category of antibiotic responsive enteropathy that we used to have, we're trying to avoid using antimicrobials empirically in these chronic diarrhea cases, because of the impact of antibiotics on the microbiota and the lasting impact on, and the fact that it can cause dysbiosis and those sorts of things, and also because of antimicrobial stewardship, we're trying to stay away from using antibiotics in chronic enteropathy cases. We don't really feel like it helps that much, and it tends to be such a small proportion of dogs that benefit from it. So it's not something we should try empirically, unless you have biopsies and they have failed glucocorticoids.
Mm-hmm. Mm-hmm. Thank you. Thanks, Aarti. Final question. Um, so someone has a case of an old dog that's been on glucocorticoids for years for chronic diarrhea, but you're not sure that the diet was really
Mm.
ever explored properly. So
Mhm.
even after all that time, and this patient has signs of, long-term glucocorticoid use, is it
Mm.
still worth trying diet?
Yeah, we've had some cases like that where the owner can't get the dog off glucocorticoids and they've tapered to the lowest effective dose, but they've not really exhausted or tried different diets. So what we do in those cases is we'll say to try a hydrolyzed diet or a different diet depending on the case history. And then we give it 2 weeks. And if the animal is still in remission, then we will cautiously try and taper the steroids and maintain them on diet. For one case, we've had really good success where they've been able to come off the prednisolone and it's been fine, and they've been managed on diet. The second case these are cases I can think of off the top of my head, so there might be more. The second case, we're in the process of doing that. So certainly they can. Sometimes if you can't, then you can try different diets, and then if they stay in remission, you can keep trying to taper and seeing if you can get them off the steroids. We've definitely had success with at least one case doing that.
That's good. Good to hear. So probably worth having a try, isn't it? So
Yeah.
great. Okay. Well, thank you so much, Artie, and thanks for answering so many questions. We do have some more questions, but we probably won't get through them all tonight. But thank you so much for such a brilliant presentation as well. So practical, and I think we're all going to come away a lot more informed, really, about how we might approach these cases in a very clear and systematic way. So thank you so much, Artie, for
Yeah.
that.
Yeah. Thank you.